Let's answer questions related to anatomy. Just basic questions, recall questions. First question is all about brachial plexus, the origin of the medial cord of the brachial plexus, anterior division of the lower trunk, posterior divisions of the lower trunks, anterior division of middle trunk, anterior division of the upper trunk. Correct answer for that would be letter A, the anterior division of the lower trunk. This nerve pulses the pectoralis minor muscle before supplying the pectoralis major muscle. A. Lateral pectoral nerve, musculocutaneous nerve, medial pectoral nerve, or the ulnar nerve. Pierces the pectoralis minor. So in this section, this is very noticeable that the pectoralis minor is being pierced by this particular nerve, and nerve is called as your medial pectoral nerve. This structure lies posterior to the axillary artery. Lies posterior to the axillary artery, thoracodorsal nerve, musculocutaneous nerve, ulnar nerve, or the median nerve if it's posterior at the back of it, the back of the axillary artery. As we know, axillary artery is just a short artery that can be viewed in this section. Short, but this is a big artery, and it's very obvious that the correct answer is the thoracodorsal nerve, because the thoracodorsal nerve is at the posterior portion during the dissection. The ulnar nerve is almost located at the anterior portion. Musculocutaneous nerve anterior, and the median nerve was the centered anterior. The following are features of Erb Duchenne Palsy. Exact. Erb Duchenne Palsy is a type of a condition or disorder in which the brachial plexus is affected. So exemption for the Erb Duchenne Palsy. Abducted shoulder, extended elbow, medially rotated arm, waiter's tip deformity. Waiter's tip deformity is just like somehow a waiter is not obvious in showing his arm that he's asking for a tip in a restaurant, for example. Or sometimes that is also called as a police tip deformity. The correct answer for this, the exemption, is abducted shoulder. It's supposed to be adducted. It's supposed to be adducted shoulder. Extended elbow, it's not flex. All are branches of the posterior cord except superior subscapular, axillary, inferior subscapular, or suprascapular. Exemption, all are branches of the posterior cord. Correct answer, that is the suprascapular. The suprascapular. Because suprascapular is a branch of the lateral cord. Patient unable to extend forearm, paresthesia of the posterior aspect of forearm. What nerve is involved? Axillary nerve, ulnar nerve, radial nerve, or the medial nerve? So your clue in here is unable to straighten, extend the forearm. So there is paresthesia of the posterior aspect of the forearm. What nerve is involved? This is posterior. So the correct answer would be radial nerve. There are two nerves included in your posterior cord. You have the radial nerve and the axillary nerve, which are your main terminals for the posterior. The best answer would be the radial nerve, because the radial nerve is the one responsible for the extensor muscles in your forearm. Patient ER, wing scapula. What nerve is involved? Spinal accessory nerve, suprascapular nerve, long thoracic nerve, or thoracodorsal nerve? Wing scapula. For wing scapula, the correct answer that would be your long thoracic nerve. So what muscle is involved for your wing scapula? That is your serratus anterior. Serratus anterior muscle. That's your long thoracic, which innervates the serratus anterior muscle. Infrascapular branches of the brachial plexus. Infrascapular. So if you say infra and suprascapular, so the basis would be the scapula. Above the scapula, suprascapular. Below the scapula, infrascapular. So which of the following is below the clavicle? A branch located below the clavicle. Upper subscapular, suprascapular, long thoracic, or the subclavian nerve? Correct answer, suprascapular nerve. It's your suprascapular nerve. Yes. Last question. Type of joint for proximal radio-ulnar joint. Type of joint for proximal radio-ulnar joint. Pivot, hinge joint, plane, or condylar. Proximal radio-ulnar joint. So that would be proximal radio-ulnar. It's not hinge because hinge is for the elbow. Elbow is for the calcaneal and your radio-ulnar. Is it plane or pivot? Condylar. It's not condylar. It's between pivot and plane. Correct answer, that is pivot. And plane for the distal radio-ulnar joint. So that would be all for now. Stay tuned for the next videos.